I'm Dr. Paul Stanislaw, and today we're going to be doing a pre-op visit for a deep plane facelift and neck lift. We're going to go over all the details. This is a standard pre-operative visit for us. Today we're going to be going over your, I'm going to listen to your heart and lungs, take your blood pressure. We're going to go over the instructions and go over your goodie bag of the things that you're going to need. And we're going to have you sign the consents. Okay? And if you have any questions, just let us know. Preoperatively, you're going to discontinue any aspirin, Motrin, ibuprofen, naproxen, vitamin E, fish oil, or herbal medications 2 weeks before and after the surgery. If you have a headache or anything like that, Tylenol is perfectly fine, but all of these things will thin your blood, and what that'll translate to is more bruising. Okay. And what we're trying to do is we're trying to minimize the bruising to minimize your recovery. Everything we're doing is trying to keep the swelling down and try to keep the bruising as little as possible. Your surgery is going to be done here in the office with local anesthetic. Okay, so in this situation, you can eat something. You can eat a little bit. No big meals, not like tons of coffee or anything like that, because we don't want you having to get up and go pee. Okay, but in this situation, it does help if you have something a little bit in your stomach, because it'll help with the medications and stuff.
Understand.
Okay. The morning of your surgery, I want you to just wash your face and neck and your hair just like you normally would. Just any general shampoo, nothing special. Okay, but we don't want you coming in with any makeup, no moisturizer, no eyeliner. No mascara, just like the day you were born.
Okay.
All perfectly clean. Okay? Now, I want you to wear a button-down shirt the day of the surgery, or a zip-up shirt. Anything that you don't have to pull over your head. When we're done, you're going to have a big dressing that's going to be wrapped around your head, and I don't want you pulling anything over.
Yeah.
Okay? So just something that zips up or buttons up.
Very good.
Okay? Before leaving your house, I am going to have you take 2 little pills that are dexamethasone or Decadron. They're a steroid, and their job is to help minimize the swelling. And they have to be in your body before I do the procedure to actually have a good benefit. Okay. So an hour before, just like when you leave your house, you're going to take 2 of those with a sip of water. You're also going to take 1 dose of your antibiotic.
Oh,
and in this situation, it's going to be Bactrim, which is a sulfur drug.
Okay.
So you'll take 1 antibiotic and 2 of the steroids. You will need someone to drive you here and drive you home. You won't be able to drive, okay? Now, that's it for the pre-op.
Okay.
Post-operatively, you're going to keep your head a bit elevated for 7 days. You're going to use 2 pillows or recliner to keep your head above the level of your heart. So if you lay down flat, the next morning you're going to wake up, you're going to be 2 sizes too big. Oh. So it's all about preventing the swelling, because once the swelling's there, there's nothing I can do to speed it up to make it resolve any quicker. Wow. Okay, so you don't have to be sitting straight up, just at a gentle incline so your head is above the level of your heart. Okay. So if you have a recliner at home, you can use a recliner. If you want to just use like a wedge or a couple pillows, just keep your head up. Okay? And that's for the whole week. No bending, lifting, or straining for 7 days. So after the surgery, you're not going to be lying in bed. You're going to be up, around, you're going to be doing stuff, you're going to be cooking, whatever you want. Yeah. But I don't want you prolonged head dependent. The more you bend over, the more swollen you're going to be. Okay, so if you're bending over just for a second to put your shoes on, that's no problem. But nothing prolonged, no Pilates, no yoga, no push-ups, no gardening. Okay, because the more you bend over, the more swollen it'll be. I don't want you driving for 7 days, or if you're taking pain medication. Now in this situation, I don't use any, I don't give narcotic pain medication. The only pain medication that I use is medication that's like Motrin that doesn't affect platelets. It's called Celebrex. Okay, so there's no narcotics.
Okay.
But I don't want you driving for 7 days. And the reason being is because if I'm doing all this work on your neck, right, and I'm lifting this up, what do you do when you drive? You whip your head around. And when you whip your head around, you're pulling on my sutures and you're undoing what I'm done. Okay, so just as important as what I do during the surgery is how you take care of it afterwards. Studies have shown that studies vary from between 2 and 6 weeks, so I just split the difference and say 4 weeks. It takes 4 weeks for the tissues to heal in place to give you the longevity of a facelift. Okay? The sutures that I use to support stuff, to hold stuff in place, are dissolvable. They're there for only 3 to 6 months. Their job that's not what gives you the longevity. It's just to hold it in place until it heals in place. Wow. Okay? So after I do this and I lift everything up, if you like open your mouth wide, okay, what'll happen is it'll pull on my stitches. You're undoing what I did. Wow. If I'm making your neck better, you're turning your head around a lot. Every time you turn your head, you're pulling on my sutures. Okay? So in the ideal world, I'd have you keep your head in as neutral position as possible for the first month. Driving is so important, I can't have you not drive for the month. Right? So driving, I don't want you doing it for 7 days. But things like golf, swimming, tennis, Pilates, I don't want you doing that for the whole month.
Got it.
When you eat stuff, you can eat anything you want, any consistency you want, as long as you chop it up into little pieces. I don't want you having a big apple, a big sandwich where you're opening your mouth wide. Okay?
Okay.
So again, that's really for the first month. All right? So you want to keep it as neutral as possible. The day after the surgery, you're going to come back and see me. And so when I'm done with the surgery, you're going to have a big dressing on your head. Okay? So there'll be a big dressing. It's going to wrap around your neck and over your head. And there'll be 2 drains that you can see. Okay, they'll look like a clear ball with a little tube to it, one on each side. There's going to be some blood in that. You don't have to touch them, you don't have to measure them, you don't have to worry about them. Unfortunately, you just have to look at them. Okay? No one likes looking at drains, but you have to think of it this way. It is an investment in the first month.
Okay.
The better I suck out any little bit of blood, the less bruising you're going to have, the quicker your recovery is going to be. Okay? So they'll have the dressing, and those 2 drains will be attached with safety pins onto your dressing. All right? You'll come in the first day, and what we'll do is we'll take the dressings all down, we'll clean you all up. I usually leave the drains in. So sometimes I'll take it out at day 1, but usually I try to leave it in for 2 days because, again, the better I take everything out, the quicker your recovery is going to be.
Okay.
So you'll come in, and we'll clean you up, and then we'll rewrap you and put the drains back onto the dressings. You'll come in on the second day after surgery. We'll take the dressings down, and on the second day, I'll remove the drains, and I will rewrap you. That wrap, that dressing, will stay on your head for the 3rd day. So on the 3rd day at home, you'll take a pair of scissors, and you'll cut the dressings off yourself. And what you'll do is you don't want to just stick the scissors underneath. You're going to take one layer at a time, trim it, one layer at a time, trim it, and then it's just going to peel off.
Okay.
On the 3rd day, when you take the dressings off, you can shower. So you can jump in the shower, you can wash your hair, soapy water, and all that type of stuff. Okay?
Okay.
So that's really how that goes for the first 3 days. When the dressings come off, you're going to have access to your incisions. And the incision is going to be, there's going to be one underneath your chin. The incision is going to go in front of your temple, under your sideburn, in the creases around your ear, and then behind your ear, in the crease behind your ear. You're going to take some Aquaphor, which is just a fancy Vaseline, with a clean finger. So you just wash your hands, just put it a little, and just by feel, just put it on the stitches and all those places. You'll do that 3 times a day.
Okay.
In the beginning, there may be some crusties or scabs that form on the incision line. So before you put the new ointment on, you'll take a little hydrogen peroxide, soak it on a little Q-tip or gauze, and just gently blot it on the scabs. And all you're doing is trying to dissolve the scabs, because these sutures are so tiny that if the scabs get wrapped around them, it gets very hard to get out the stitches.
Wow.
So all you're doing with the hydrogen peroxide is just getting rid of those scabs. So 3 times a day you'll clean it with a little hydrogen peroxide, you'll put ointment on it when it's dry, and then after a couple days you'll notice that the scabbing will stop. There'll be no more scabs. When the scabbing stops, you do not need to do the hydrogen peroxide anymore.
Okay.
Okay, so the hydrogen peroxide isn't really to clean it, it's just to remove those scabs. When there's no scabs, you can stop that. But as long as you have stitches in, you're going to keep the Aquaphor onto those stitches.
Okay.
Studies have shown that the Aquaphor on the stitches will make the incisions heal better.
Yeah.
Okay, so that's basically what you're going to be doing for the first 10 days. Now, you can apply makeup. So if you have bruising in, like, around your chin or other areas, you can put makeup on those areas, but you cannot put makeup on my stitches.
Oh.
So you can't put on these incisions or the little incision there. Okay. Once that you've taken the dressings off, on the 3rd day and you shower, you can wash your hair. Number one thing, very important, is that you can't use a hair dryer to dry your hair.
Okay.
If you do, it has to be on cold. So when I do the surgery and I make these incisions, the areas that I operate on are going to be numb. Okay, that's perfectly normal. There's no way for me to do the surgery without those areas being numb, because the nerves come up from the bottom and they innervate the skin from the bottom. And when I move that skin, I have to cut underneath, and I move it until those nerves get cut. Those nerves will grow back. It usually takes a couple months, usually around 3 to 6 months for those nerves to grow back, for that sensation to come back. Now, if you're using a hair dryer and you're drying your hair, you can actually burn your skin. Okay, so you want to be very careful that you don't use a hairdryer on hot or warm until that sensation starts coming back. Okay, and I actually have had a patient burn themselves 2 weeks out using a hairdryer in front of their ear. So just be careful with that.
Okay.
Okay. When the dressings come off, we usually have people use an ace wrap, and what they do is they put the ace wrap, it wraps around their head and under their chin to give this neck area a little bit of support. But really what it becomes is like a safety blanket. It just sort of reminds you not to whip your head around.
Okay.
So for that first week, after that dressing comes off, you'll wear that all the time at home. After the 10 days when we take the stitches out, we just have you wear that at home when you're at home. So you can go out, you can go grocery shopping, all that type of stuff. But when you're at home, just use that ace wrap for the first month. After a month, you can start moving your head more, because it's healed up enough. And I tell people just listen to your body, right? Each day it's going to get better. You'll be able to move your head a little bit more. It won't feel as tight. And so at a month, I'll liberalize you. I'll say, well, you can start working out. You can start doing your other things. But listen, if it feels tight to here, don't push it. Don't try to force it. It'll get better on its own. The other thing in regards to that is that you're going to feel tight afterwards. You're not going to look tight. But for that first month, I need you to feel tight, okay? Because there's very few things I can guarantee, but what I can guarantee, it's all going to relax, it's all going to try to fall, it's all going to try to go back to the way it was, all right? So I have to overcorrect a little bit because just think of it, when it's swollen, it's pulled around a certain volume, and then when the swelling goes away, it's going to deflate, right? So it's going to be a little tighter, and I really need you to feel tight for that first month. Because if you go home, and what's the natural inclination? Oh, I feel tight. I want to stretch it out. I want to open my mouth. I want to turn my head because I don't like feeling tight. Well, if you do that, you're undoing the sutures. The sutures are going to pull through the tissue and things are going to fall. Your scars will turn out to be wider.
Okay.
Okay? So being tight's normal. Feeling tight's normal. It's not looking tight.
Okay.
Okay? In regards to looking tight, there's two things that I like to tell people preoperatively that's very important. The swelling will peak out on the second day. So we do the surgery on day 0. First day you're going to be swollen. Second day you're going to be more swollen. And then after the second day the swelling will start to go down. So that first 2 days you might look tight. You might look a little pulled because of the swelling. And then as that swelling goes down, it's all going to relax. It's all going to go back to the way it was. So I tell people, don't be scared. Don't freak out. Don't like, oh my God, why did I do this? That's a very normal appearance at around that 2 days because of the swelling. Okay. The other thing that I like to tell people about with the surgery, again, so that they know it beforehand, is that when I do the surgery, I'm injecting numbing medication. Okay, that numbing medication lasts for about 8 hours, and that not only does it numb you, but it also stops your muscles from moving. Right. So when we do the surgery here, it's not uncommon for me to be all done, have you all dressed and you're ready to go, and still have muscles not working very well. So like you go in your car and you look in the mirror and you're like, oh my God, my face isn't moving. That's just purely the numbing medication. It does take a couple hours to wear off. Okay, so don't be alarmed by that.
Okay.
All right, so I like to tell people beforehand, because if I start telling you that afterwards, you're not going to believe me.
Okay.
So that's very important to understand. And then the last thing that I tell people is, people will ask me, well, how long can I go out? How long will it be before I go out without people knowing? And I generally tell people it's about 2 weeks. Especially for women, they can pull their hair down to cover it. But what happens is, like right in front of the ear, right underneath the sideburn, you're going to see a little dimple and a little swelling above it. Okay, and that's because the dimple is where the sutures are anchoring it and pulling it tight below. And above that spot, there's no tension on the incision. The incision is loose and the skin is loose so that it heals better, the scars heal better. But because this is loose, this will swell above it a little bit. So you'll see tight and then a little swelling. One side will always be a little bit more swollen than the other. Perfectly normal, okay? And that swelling can take, that's sort of the longest. It can take about 4 to 6 weeks to go away, okay, for that to settle down. So for women, I tell people just keep your hair as long as you can, and you can pull that over. For guys, it's a little bit different. So for guys, I tell people, it might be a couple weeks before you can go out, because generally they don't have hair, it's long to cover that. So that's sort of the thing that's going to take the longest to go away. No matter what I do, I tell people beforehand, they always ask me about it afterwards. you'll come in and say, yeah, it's swollen here. Why is this more swollen than the
I'm
other?
retain that.
All right, so it's going to be videotaped so that we have proof that I told you that. But that's a normal question. People always ask me that, and that just takes the longest for that to settle. Eyeglasses can be worn at any time. When the dressing's on, you're going to have to, if you have flexible paddles, you can sort of wiggle it underneath. So if you have contacts, you can wear contacts, not a problem.
I think I'll go with that. Yeah.
Okay, so that's pretty easy. You can shampoo your hair, again, after 3 days, after you take the dressings off. Any shampoo is fine. The thing that I'm going to tell you is that your hair is going to be greasy from the Aquaphor.
Oh,
When you
right.
wash your hair, don't sit there and try to wash every bit of grease. I've had people where they wash it 10 times in one day to try to get the grease out. Don't even bother. It's going to be greasy for the whole week.
Sure.
All right, so just whatever shampoo you want is perfectly fine because you're going to reapply the ointment on it. The thing that I tell people is that at day 10, I usually have them do Dawn dishwashing soap to get the grease out. Right, so they use it on the ducts and the oil spills. So basically, I have them just wash their hair with Dawn dishwashing soap to get the grease out, because at that point, the Aquaphor will have stopped. That's pretty much it for that. All right. So on this instruction form, there's the office phone number. There's my cell phone number. So if you have questions at any point, after hours, whatever, just give me a call.
Okay.
Okay.
That's awesome.
I'd rather have you call me than wait. Right, so if it's Saturday and you're not sure of something, or you think you've got a rash from the antibiotics or something, just call me.
Okay.
Okay. On the back side of this for you, the antibiotics that we're going to prescribe for you, again, is the Bactrim. It's the sulfur drug. It's 1 pill twice a day for 7 days. For other patients, I may use a different antibiotic, depending on allergies and such. For discomfort, we're going to have you use extra strength Tylenol. That's Tylenol 500 milligrams, 2 tablets every 6 hours is needed for pain.
Okay.
Tylenol can be toxic to your liver, so you can only take so much in a 24-hour period. So that amount is 4 grams. That's the total. So that's essentially 2 extra strength 4 times in one day, and that's it.
Okay.
Can't take any more. Okay. What we have you do is alternate that with another medication called Celebrex, which is the commercial name. The generic name is Celecoxib, which is 1 pill twice a day as needed for discomfort. Again, it's like a Motrin. It doesn't affect the platelets. It works very, very well. It doesn't have the GI upset of narcotics. It doesn't have the ups and downs of the narcotics. It just keeps you on an even keel. The other thing that's good about the Celebrex is that it helps prevent swelling. It helps treat swelling where narcotics do not. So oftentimes a lot of my patients don't want to take medications at all, right? And so there's definitely a percentage of people where I do the Facelift Necklift on someone, and they don't take the Celebrex, they don't take the Tylenol, they don't want to take anything. All they do is take the antibiotics, right? Because they want to be minimalist. They don't want to take pills that they don't have to. I would have to say the majority of my patients just take Tylenol. Okay, that's all they really need. That's all they really want to do. Then there's a percentage of people that take the Celebrex. They'll take that for the first couple days, and then they'll stop. I like taking the Celebrex just because it does help with the swelling. So even if you don't need it, it's nice because it does prevent the swelling.
Okay.
Or help treat the swelling. But again, I fully respect people's decisions not to take medications they don't have to. You do not have to take it. The only medication you do have to take is the antibiotic.
Okay.
We won't do the surgery without you taking the antibiotic. Okay?
Got it.
So the Celebrex is 1 pill twice a day. That is a prescription, and it's only as needed for pain, alternating with the Tylenol, which is every 6 hours as needed. Now, if you remember in the beginning, before you left your house, you took 2 little pills that were the steroid. Okay? You'll take those same 2 pills 8 hours later, and then 8 hours after that, you'll take that again. So it's 3 doses of 2 pills. 2 pills, 8 hours later, 2 pills, 8 hours after that, the last 2 pills. Again, that's just trying to diminish the swelling, preventing the swelling from ever coming. Also helps with discomfort. So it does a lot of good things.
Okay.
Okay. Sometimes I will not give that prescription to patients if they don't want to take medications. I'm fine with that. You don't need to take the steroid. Or if someone has diabetes, ulcers, or glaucoma, I won't give them the steroids. Okay. But in your situation, it'll just help your recovery be quicker.
Okay.
All right. Here are all your post-op visits. All right. So again, we're going to see you obviously the day of surgery in the office. We're going to see you the first day, the second day, the 7th day, the 10th day, and then the 1 month. And those are all here. Then we'll see you back at 3 months. Okay, and that's all included in the procedure. All right, so we also have another piece of paper that spells out the prescriptions again. It's a little bit more in depth. It has the dates in which you're going to take them. So before the surgery, you'll take the dexamethasone and the Bactrim. All right, so 2 pills and 1 pill. And then after the surgery, she has the Celebrex, the steroid, the antibiotic, and the Tylenol as needed.
Okay.
So this is just another way of phrasing the same. Okay, and here are your prescriptions. There's the Celebrex, the Decadron, and the Bactrim. A lot of times, insurances are not so good for prescription coverage, and I'll often recommend that they go get an app on their phone called GoodRx, and that app for GoodRx does a real. You can get prescriptions for a lot less.
Oh, yeah?
Like even with my insurance, I do better with the GoodRx than I do with my own health insurance. Okay, so if you ever have an issue, like say they said it's $200, get the GoodRx app, look it up, and it'll oftentimes be less expensive than your insurance.
Okay.
So there's 2 consents in this situation. If we were doing your surgery at the hospital, there'd be 3 consents. If at the hospital, it would be the hospital's consent, my surgical consent, and my cosmetic consent. In this situation, since we're just doing it here, it's just my surgical consent, my cosmetic consent, and I'm going to go over these. So the surgical consent goes over the material risks of the surgery. This is the important one.
Okay.
Okay? So it's you and it's me. It's a facelift necklift, and in your situation, we're doing a deep plane facelift. Okay? Now, the risks include, but are not limited to, bleeding, infection, scarring, and allergic reaction to the medications. Okay, so like any surgery, the risk of bleeding is, in this situation, I've never had an issue with bleeding. Okay. Right? Some people bruise a little, some people bruise a lot, some people the bruise goes away quickly, some people they hang on to the bruise for a while. Okay. Have I had people still bruise in a month? Sure I have. Have I had people that did not bruise at all? Absolutely. So usually I tell people it's about 10 days for the bruising, okay? Infection, again, I've never had an infection, but I do give you the antibiotics to diminish the risk of infection, okay? Scarring, again, that's like scars that widen or people who have keloid scars. In the 20 years, I've had 2 people have keloid scars where I had to revise that scar and then inject them with steroids to diminish that, okay? Allergic reactions, I'd have to say that's the most common thing. Someone becomes allergic to the antibiotics or the pain medication or something like that. They have a rash, they have a fever, anything like that. Okay, so that's probably the most common in just frequency. Now, when I give you antibiotics, the antibiotics could kill all the good bacteria in your colon, and if you have a bad bacteria in there called C. diff, so if you worked at a hospital, if a spouse worked at a hospital, if you had grandma who was in a nursing home and had this, you could potentially have that bad bacteria in your colon. I give you an antibiotic. The antibiotic kills all the good bacteria, so now there's no competition for that bad bacteria, and that bad bacteria can grow over everything, all right, and take over and secrete a toxin and give you really bad diarrhea. And it's getting actually harder to treat because that's getting resistant as well.
Wow.
Okay. Now, have I had patients with C. diff? Yes, I've given a patient C. diff with just 1 dose of amoxicillin, just a plain old antibiotic. It's not that frequent, but it does happen, but we try to keep it to a minimum. Okay, so some antibiotics are more prone to do that. We try to avoid those antibiotics. Okay. We also, actually, we did not go over this, is when you're taking your antibiotics. So the antibiotics is 1 pill twice a day, okay, and it's for 7 days. While you're taking the antibiotics, I want you to eat. Do you like eating yogurts?
I don't usually do dairy.
All right. So in your situation, I'd have you do a probiotic. So a probiotic pill. So while you're on the antibiotics, I want you to do a probiotic pill. Just follow the instructions. It doesn't matter what brand it is for me. It just I like the brands that have lots of different bacteria in it, not just one bacteria in it. And the thought is as we kill the good bacteria with the antibiotic, we're replacing it with more good bacteria to try to diminish the risk of you getting a diarrhea. Okay, so if people like yogurt, we usually have them do 2 cans of yogurt a day. Again, it could be made into a milkshake. It doesn't matter. All right, so that's about with that. So C. diff diarrhea could happen. And then that could happen up to a month out, really bad diarrhea. Okay, if that happened, we'd have to check a stool sample. If it was positive, I'd have to send you to a different doctor to treat that infection.
Okay.
Okay? Now, Specific to this surgery, additional risks include but are not limited to temporary or permanent asymmetry, contour irregularities. So asymmetry would be like that neckband hangs down more than that neckband. I'm going to do my best to make it as symmetric and as good as I can. But there's always the risk that that neckband, because it's worse, it still hangs down a little bit more. Okay? Contour irregularities. Contour irregularities would be like lumps or bumps that don't go away. You're going to have lumps and bumps right afterwards, and they will go down as the swelling goes down. Okay? Flap non-viability. That means that when I make these incisions and I lift up that skin could die, right? And then it would be a wound and have to heal, and it would be a bad scar. Again, I've never had that happen. So we talked about facial numbness. So facial numbness, I am going to make you numb afterwards, right? Everywhere I operate, it's going to be numb. It's going to take months for those nerves to go back. There's no way for me to do the surgery without it happening. There's always the risk that the numbness is permanent, that it doesn't go away, okay? Again, I have not had that as an issue. This is specifically in regards to, if you looked in any research, you'll see that, or any textbook, the most common nerve injured in a facelift surgery is the greater auricular nerve. That's the nerve that comes here, goes to your ear, it gives you innervation to your ear. If that gets cut, your ear could be numb forever. I've never had that happen. But if you look in any textbook, that's there. The next thing is facial nerve injury. Okay, so we talked about the nerves that come up that give you sensation to the skin. There's another nerve that's deep underneath. It's in the parotid gland, comes out from the base of your skull, and it branches in front of on the side of your face. Those branches go to your forehead muscles, the muscle that closes your eye, the muscles that allow you to smile, to pucker up. Okay, so that nerve is the motor nerve. All right. Now, if that gets stretched, it could go to sleep. Okay, if it gets stretched, it'll come back. If it gets cut, it may not come back the normal way, and it can be really, really bad. Yeah. Because it can be very deforming, right? And once a nerve's cut, you can never really get it to grow back the way it was. I've never had that as an issue. Okay, it doesn't mean that you can't be the first. Okay, but I take that very seriously, and that's a risk.
Okay.
Okay. Now, it's if you look in any textbook, that's a risk.
Okay.
Okay. Recurrence. You're going to get older. I'm not stopping you from aging. No. So things will continue to sag. Things will do. The better you are with wearing your sunblock, the better you are with doing your retinoids. Those are the things that we can control. We can help you maintain your elasticity for longer, not make you elastic again, but make you hold on to it for longer. But things that we can't control the bone loss in your face. We can't control the fat loss. So as your facial skeleton changes, as it deflates over time, things will sag again.
Okay.
Okay, so there's always the risk of recurrence. Everything I do has a risk.
Yeah, of course.
And I do everything I can to mitigate those risks, but there's no way to say it's zero. Next, consent. This is my cosmetic consent. There is nothing legalese or fancy about this. This is very, very straightforward. So it's you, it's me, it's bilateral face and neck lifts on self. This goes over asymmetries of the human body. Then like one cheek is flatter than the other, one neckband is hanging down, and that's normal, and we're doing everything we can to make it as symmetric as possible, but I cannot make you perfectly symmetric. The next thing is, say I'm throwing up all night long, or I get COVID, I can cancel some reschedules. Say you're sick, and I don't think it's a good idea, I can cancel some reschedules, okay?
Of course.
Goes over that you're going to follow my instructions to the best of your ability, right? So if you have any questions, preoperatively or postoperatively, you've got my cell phone, just give us a call, okay? Goes over photographs. Your photographs are purely for your medical record. They're not going anywhere. I'm not showing them to anybody. I'm not doing any research right now on facelifts, so there's no articles. If I wanted to show your photographs, I'd ask you specifically. If you said yes, you'd sign a completely separate consent that would spell out which photographs I can use, how I can use them, where I can use them.
Okay.
Okay? And the last part is it goes over that you're telling me the truth. That you didn't have, this isn't your 18th facelift surgery that you didn't tell me about, or you had crushing chest pain this morning that you're not telling me about. But you can take your time, just read that over, and I need you to sign on the second page.